Have you been diagnosed with an L4, L5 disc bulge or an L5S1 disc bulge through your doctor or with a medical report, an MRI report, and wonder how long it will take to recover from a disc bulge?
Helping you relieve pain, conquer stress, and supercharge your health the chiropractic way.
Hey everyone, it's Dr. Walter Salubro here today, and in this video I'm going to answer a commonly asked question I get about L4, L5 disc bulge or L5S1 disc bulge, and it's this: how long does it take to recover from a disc bulge? Or how long does it take to recover from an L4, L5 disc bulge or an L5S1 disc bulge? And as always, be sure to subscribe to my channel below, hit that notification bell so you get instant notification about my upcoming videos that I do on a weekly basis and give you insights and tips on how to relieve pain and live a life free of chronic pain. Now, I know that disc bulges can be very, very disabling and cause a lot of discomfort and pain for a lot of people and a lot of suffering, especially when the pain is chronic. It's been going on for months and months, and let's say it's going down the leg, the pain is triggering a nerve response into the foot or sciatic type symptom that's emerging from an L4, L5 disc bulge or an L5S1 disc bulge. Many times people wonder, well, how long is this going to take to get better? How long will it take for this disc bulge to recover? And unfortunately, that's not a very easy question to answer. Everyone's disc bulge condition is completely different. I've been helping people for the past 20 years in my office, my chiropractic office, with conditions that relate to symptoms coming from L4, L5 disc bulge or L5S1 disc bulge. And in some cases, the people get better within weeks with chiropractic care, and in some cases when the problems on the spine, the degeneration, the alignment issues and misalignment issues on the spine, the amount of trauma that they've accumulated over many years, arthritis, this can actually complicate the recovery. So I have seen patients where they've recovered within a few months. I've seen patients where they recovered with a disc bulge symptomatology and condition within, let's say, 6 months, and in some cases can be even 9 months or even 12 months. Again, there's really not one specific answer I can give to any one person's specific condition, because everyone's clinical low back disc bulge condition is completely different, and how they respond to treatment is also different. However, I do know that when it's dealt with very properly, an L4, L5 disc bulge symptomatology or condition, or an L5S1 symptomatology or condition, that there is hope. People can recover to full function. And also, the key thing is also people can avoid surgery. In fact, I'll share you a story, a case study. We had a patient that came to us at one time, and she actually had an MRI that talked about, that reported that there was an L4, L5 disc bulge and an L5S1 disc bulge. And she had surgical consultations, and the surgeon recommended surgery. She was a fairly young woman in her upper 40s, and she really didn't want to do this surgery, and she wanted to avoid it. Meanwhile, her clinical presentation was that she was stooped over in that antalgic posture to get relief from her back pain. She had chronic low back pain, leg pain and weakness into her legs as well, and she also was losing time from work. So we came to our office because she heard about chiropractic and what we do in our office through corrective chiropractic care, and I assessed her spine and assessed her posture, did a bunch of other neurologic testing, and we took x-rays and noticed that there was definitely problems on her spine. And what we did is we started to apply corrective techniques on her spine, spinal corrective techniques, where we began to adjust and correct the shifting and misalignments of the spine, and we gave her some mobilization exercises and gave her some stability exercises, and it took a good, I'd say, 6 to 7 months for her to improve her complete condition, where she basically was immobilized in a lot of chronic pain, a lot of emotional suffering, to the point where, and her pain intensity was 10 out of 10 at the beginning, to the point where she was able to go back to work, because she was off work before, now go back to work, a lot happier and smiling on her face, and walking better, no more leg pain. About a 1 out of 10 intensity, not 100% gone, but a 1 out of 10 intensity with her low back pain, more mobility, more freedom, more happiness, and she's getting full function with her life. So we were able to help her with corrective chiropractic care, but it did take a good 6 to 8 months. So I know it's not an easy question to answer on how long it will take to recover from an L4, L5 disc bulge or an L5S1 disc bulge, or how long it will take to recover from a disc bulge, because every situation is different. But what I can say is that it needs to be checked in many cases professionally, especially by a chiropractor, because a chiropractor works on correcting the spinal structure problems that could have been related to the disc bulge injury over many, many years. So definitely look into a chiropractic office into your area. Ask for their expertise and their experience in helping people with alleviating symptoms related to L4, L5 disc bulge or L5S1 disc bulge. And also the key thing is to stick through the treatment plan, stick through the recovery plan or the care plan, because it's gonna take time. You can't expect a spinal degenerative problem that's been there for 5, 10, or 15, or 20 years actually get better in a matter of weeks. It's just not a very realistic expectation. So stick through it, follow the recommendations, do your home care, do your home exercises, and continue on with the corrective care plan. And in time, the body will go into healing mode, and a lot of the symptoms should and may get alleviated with proper care. So I hope you enjoyed this video, and as always, subscribe to my channel below to get updates on new video content that answers questions about coping and relieving chronic pain conditions related to spinal problems. And of course, you learn about corrective chiropractic care and what we do in our office. As well, hit that notification bell and comment below if you have a question. I do my best to answer all questions, and share this with someone that you know that may find this useful. Add it to your playlist, and I'll see you again on the next video.
To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.